Hi guys, welcome to my YouTube channel. I'm now on my health, beauty, and fitness playlist. I'm doing now an after video with Dr. Eric Tan. He's actually filming me, and you know, I had my toenail, it fractured a little bit and an old one grew back. What was it? The bad one fell and a new one came on, and Dr. Tan has been monitoring that nail. And so now I'm going to show you how good it looks. But remember, fun comes first, and if you like this video, please remember to hit that subscribe button, and here we go.
All right, so it's been about 2 years since we started this journey, and
Yes,
over time, it started where you started to have a lot of thickening of the nail, especially the big toenail, and then also some issues with the other toes. And so over the years, we've tried the topical medications. We've also tried the oral medications, including the terbinafine. And I think with that certainly has helped. You can see the nails look a lot healthier, especially the lesser toenails, 2, 3, 4, and 5. They look pretty normal. The big toe still kind of has some thickening to it, but you've done pretty good about making sure that it gets sanded down and filed, and certainly we cut it as we need to.
Right, I've been going to the local, what do you call them, manicurist, pedicurist?
Yeah, and that's certainly safe. You just want to be careful sometimes where, you don't want them to dig in too hard, because sometimes if they go in to try to get some ingrowns or other things like that, that can certainly cause some bleeding and infection. So we do want to be careful about that.
They know what they're doing, and the intensity of what they're using is...
Exactly. And so, you did bring this today. This is a kind of nice little tool you can find on
Amazon.
Yes,
I bought this on Amazon. It's called if you want to go on Amazon, it's called the Salon Nail. It costs about $14.99. It's like 4 weeks. And so, Dr. Tan, I brought it here. So
it's a reasonable tool. The idea behind it is helping to just basically file the nail down so it doesn't get too thick. Because as the nail gets thicker, that can be something that ends up being painful or ends up cracking the nail. And so it has different heads that you can interchange, and that can get in different nooks and crannies. You don't want to be too aggressive about it, but you can kind of see it powers on a higher speed or a lower speed. And the idea is you just take it on the nail, and then you can certainly around the edges too. You can make sure it's not sharp, and then you can also go around it just to make sure it thins out the nail. But you do want to be careful that you don't cause any bleeding or things like that. But after you get it cut or trimmed, you can certainly use this to go over it.
I can do it myself and use my own judgment. And obviously, if I start giving myself pain, then I need to back off.
Right. And so overall, utilizing this as well as the medications, I mean, we certainly have made progress here, but you want to be patients too. Things that are topical and stuff can be less effective. The oral medications can certainly be effective, but we do have to, we have monitored some of your levels and stuff because it can affect your kidneys and other things. So we just want to make sure that you're
Should I show that bottle or no? I have the bottle.
No, okay. Yeah.
Okay. So then, after all, we have a good outcome.
Yeah, so things are progressing along. I mean, it's something that it never quite fully goes away, to be honest with you. And so it is about kind of maintenance, just making sure you're taking care of it. You're trying to debride the nail and make sure that it's stable so it doesn't get thick again. And sometimes we do have to rinse and repeat some of these options to move you forward.
So the fungus could come back?
Absolutely. It doesn't
by going in dirty water?
Well, sometimes it's as the nail grows out, it's just something that doesn't fully go away. And so sometimes, you've done a lot of things to kind of keep it at bay, but sometimes as we stop the medications and stuff, it is possible it comes back, and sometimes we have to do another round of things or freshen things up.
So I should do a follow-up with you in...
Yeah, so we'd probably see you in 3 to 6 months, just to make sure you're doing okay, and obviously you know how to get a hold of us in between.
Yes. Okay. Well, thank you, Dr. Tan.
No problem.
Alrighty. Stay tuned for more.